My PowerPoint presentation is on substance abuse, risk factors, and health consequences. Defining substance abuse. According to the World Health Organization, substance abuse refers to the harmful or hazardous use of psychoactive substances, including alcohol and/or illicit drugs. Substance use can lead to a dependent syndrome, which are a cluster of behavioral, cognitive, and psychological phenomenon that can develop after repeated substance use. Types of substance abuse. Prescription medications such as Vicodin, OxyContin, Percocet, or Xanax. Alcohol, heroin, fentanyl, cocaine, and marijuana. According to the National Institute on Drug Abuse, the three most commonly abused substances in the United States are opioids, stimulants, and CNS depressants. This is a graph that is admission to treatment programs from 2008, showing the specific drugs of choice that led to admission into treatment programs. So alcohol would be this. Alcohol plus another drug is the darker. Marijuana would be the orange, and so on and so forth. Risk factors. Risk factors for substance abuse include a family history of addiction, having a mental health disorder, peer pressure, lack of family involvement, and beginning substance use at a very early age. The risk factors for addiction, this picture that I've included goes over biological factors, psychological factors, and environmental factors. Biological factors include unusual early response or use to substance, attention deficit hyperactivity disorder, as well as other learning disabilities, biologically based mood disorders, such as depression, bipolar disorder, and addiction among biological family members. Psychological factors include low self-esteem, external locus of control, looking outside oneself for other solutions, passivity, and post-traumatic stress disorders. Environmental factors include ready access to substance, abuse or neglectful home environment, peer norms, misperception of peer norms, membership in an alienated, oppressed, or marginalized group, and life events including chronic or acute stressors. Social and mental effects of substance abuse include tension among families, relationship changes toward friends, aggression toward family and friends, depression, mood swings, memory loss, and anxiety. This picture shows abuse or dependence by drug and mental illness. So abuse of alcohol over here correlates. The dark blue is serious mental illness. This is moderate mental illness, mild mental illness, and then no mental illness. So it shows how the mental illness affects the substance use. Health consequences of substance abuse include a weakened immune system, heart conditions, nausea and abdominal pain, strain on the liver, seizures, and lung disease. The effects of opiates on your body include heavy opiate use can cause sedation, slowing of the GI tract, chronic opiate abuse creates a greater sensitivity to pain, vulnerability of the immune system, infected needles can cause hepatitis, respiratory depression can happen, especially with opioids, heart lining can become infected due to contamination from heroin or crushing pills. So there's various health consequences of substance abuse, of course. Behavioral variable, focusing on parental involvement. Statistics from a study by the United States National Library of Medicine, National Institutes of Mental Health found that adolescents who had a very involved parent in their life were 40% less likely to drink, especially to the point of drunkenness, and are 43% less likely to use marijuana than their peers with no parental involvement. Non-behavioral variable, low socioeconomic status. According to the Recovery Network for Dual Diagnosis, substance abuse is more prevalent among individuals living in poverty. Around 20% of people on welfare in America have reported using some sort of illicit drug in the year prior to being surveyed. Data acquired in 2003 estimated that 38% of the homeless population were alcoholics and 26% were drug abusers. Often, homelessness is in and of itself a result of substance abuse. The health belief model perceived seriousness, perceived susceptibility, perceived benefits, perceived barriers. Some perceived barriers relating to substance abuse would include withdrawal, not being able to afford treatment to get help, fear of not being able to live without their drug of choice, and mental health issues. Here is a picture highlighting using the health belief model to explore community action and substance abuse issues. Interventions. The aim of Healthy People 2020 is to reduce substance abuse to protect the health, safety, and quality of life for all, especially children. Some ways in which to accomplish this is to reduce overdose deaths with naloxone or Narcan, identify and punish prescribers who provide large numbers of narcotics, use TV, radio, and social media to educate people, establish and implement medical guidelines for the treatment of chronic pain, making drug and alcohol screenings part of the standard of medical care, increase the availability and affordability of drug treatment programs, educate physicians, patients, and families about what good addiction treatment must include, promote and pay for the use of medication-assisted treatment. There are several different types of intervention when it comes to substance abuse. The Johnson model is the most typical form of intervention and is a traditional and confrontational method. The ARISE method is an alternative to traditional confrontational methods. There are no secrets, and the person who is addicted is involved from step one. Family systemic intervention includes the entire family and the person battling the substance abuse, right from the very beginning point. Here are my references included. Thank you so much.